A pneumonia of unknown origins broke out in Wuhan as the year 2019 came to an end. It soon snowballed into a raging epidemic. The first handful of cases were reported to Wuhan's health authorities on December 27th. 3 days later, the Wuhan Health Commission released treatment guidelines. On December 31st, the National Health Commission sent its first expert team to Wuhan to conduct on-site investigation. The Chinese Center for Disease Control later contacted its U.S. counterpart on January 4th to brief them about the disease. China's National Health Commission reported the situation to the World Health Organization on January 9th. China shared the genome sequence with the organization as well as the global initiative on sharing all influenza data on January 12th. On January 7th, President Xi Jinping chaired a meeting and urged authorities to address the situation. On the very same day, China successfully isolated the strains of the novel coronavirus. On January 16th, diagnostic reagents for testing the virus were developed, and Wuhan started to test suspected cases. As the coronavirus raged on, the central government sent more expert teams to Wuhan, and the teams revealed their key findings on January 20th.
它是肯定的有人传人，没有特殊的情况呢，是不要去武汉。
On the same day, Chinese President Xi Jinping instructed that all-out efforts should be made in the prevention and control of the contagion, stressing that party committees and governments at various levels, as well as relevant departments, should put people's health first. Following President Xi's instructions and the experts' findings, China soon raised the infectious disease alarm from Category B to the highest level, A. Such classification requires faster reporting and stronger isolation measures.
自2020年1月23号10点起
A few days later, on January 23rd, authorities imposed a travel ban in Wuhan. The city went on lockdown.
就是对武汉的封城起到了非常重要的
The lockdown of Wuhan plays an extremely important role in prevention and control of the epidemic. We have to strictly control the sources of infection, the infected and those who come in contact with them.
On January 25th, the first day of the Chinese Lunar New Year, President Xi chaired a meeting and urged party committees and governments at various levels to mobilize all available resources to curb the spread of the contagion. Facing the raging outbreak, over 500,000 local medics in Hubei province stuck to their posts. But given an increasing number of infected patients and shortages of medical supplies, they needed more help. In response, the People's Liberation Army organized 3 medical teams which arrived in Wuhan on January 24th. They were the first groups of medical assistants from outside Hubei to come to help.
We managed to set up the team and conduct the necessary trainings within just a few hours. The team is experienced in fighting infectious diseases since we fought SARS and Ebola in Africa. We are experienced and able to accomplish the mission.
And there were more. Over 340 assistant medical teams with more than 42,000 medical workers gathered in Hubei from across the country. All the while, various departments and ministries coordinated and worked together to contain the outbreak. The Ministry of Commerce activated a material supply mechanism involving 9 provincial authorities through which basic items, including medical materials, steadily flowed into Hubei. The Ministry of Transport announced measures that allow trucks and vehicles delivering medical workers and supplies to use highways freely. The Ministry of Finance and the National Health Commission issued joint announcements to implement special allowance policies. The treatment of infected patients is free, and the policies enable all infected patients to get treated for free by subsidizing the expenses that medical insurance couldn't cover.
The speech and the instruction of President Xi Jinping has made it works. because in this situation, we must focus on the people's health and the prevention and control of the virus, not other things. In the face of this lethal virus, we must be very collective behavior and action.
Cities were on lockdown, businesses suspended, public events cancelled, and people were under home quarantine. China came to a stop, but the force of the whole nation was mobilized to fight the invisible enemy, not only in Hubei, but across the country. That was a feat unmatched anywhere and at any time in China, uniting and mobilizing all Chinese people to battle against the novel coronavirus.